Hello, everyone. I'm just going to go ahead and get my slides started here. And I want to welcome you to tonight's session. I'm going to be talking about how to get the most out of your doctor's visits. And I can tell already from some of the questions that you have submitted as you register that this is going to be an exciting discussion today. And I want to really start out by, first of all, thanking my co-presenter, Julio Nunez, who is a physician from Brazil, who has worked very closely with me on a number of research projects. And Julio has helped me to design the slides for today, but is also going to be giving a version of this presentation in Spanish. I want to definitely just have a call out to Julio in helping me with this session. So the topic is how to get the most out of your next doctor's visit. And I want to let you know that clearly in this title and this presentation, I myself have some critiques about how doctors practice. And although we might hope that doctors would be better at communication, sometimes they're not. And as I've continued my career, this issue of communications and how well physicians do at communicating and how they could do better has really evolved to be one of the issues I'm most passionate about. And that's reflected in the talk today. So, the main point is that there are many strategies that patients can use to have more successful doctor's visits. And while I wish that this sort of statement weren't necessary, the fact is that we have a very complex healthcare system where doctors are trained in a certain way, and that training and their busyness doesn't always serve the best interests of patients. So it really becomes incumbent on patients to be their own advocates. And I really think that by following a few tips, you can get the care you really deserve and the care you really want. And in giving this talk, I'm really talking to you in some sense as a fellow patient, because I have had a long career as a patient ever since my early 20s when I was diagnosed with kidney failure, but also as a physician who continues to practice primary care, internal medicine, and who has my own critiques, as I said. But this in a way is a way of bridging both my patient experience and my experience as a clinician, and to, in some sense, share with you some insider tips of how we can get the most out of care. So I'm going to really focus on 4 types of tips. The first one is a really simple one, which is wherever you can, bring a family member with you to your doctor's visit. And I'll go into some of the rationale for this. It's really important that, we have support as we talk to our doctors. And then it's also important to know what the doctor really needs to complete their work. Doctors are incredibly busy, incredibly overwhelmed in some ways in our current healthcare system. That isn't a healthy thing. And yet it often is reflected in less than good care to patients. But if we know what the doctor really needs to do his or her job, we can get more out of the visit. And then thirdly, despite some barriers to perhaps feeling as free as possible to ask questions, it's absolutely critical that patients be willing and able to ask questions of their doctors. And then fourthly, to really recognize that you can have a bigger role to play in your own healthcare. And this not only has to do with what happens in, let's say, a clinic office visit, but also your own role for taking care of your health when you're at home, when you're not in that clinical setting. So I want to start out just, kind of saying, again, this idea that I'm hoping to provide you with some insider information that, is based on a few things. First is that as we think about doctor's visits and how they could be improved, I'm really hopeful that moving forward, we're in an era where patients can partner with their clinicians to really receive care that's more patient-centered. There are many trends encouraging that are in this direction, although I think most people would agree we're not really at this phase where we can say this typically happens. I also want to just acknowledge that most physicians have enormous skills and truly do care about their patients. But some of those skills and some of that caring doesn't necessarily always come up because the reality is that physicians are short on time. They work within lots of other constraints. And in some ways, the training of clinicians is so focused on technological care that they're not always attuned to the needs of the individual patient, particularly in an outpatient or clinic setting. So this is my vision of where we should be heading with healthcare. And this is that idea of patient-centered care where the patient and the doctor have values and a practice that is aligned, where care is collaborative between patients and physicians, where the physical and mental comfort of the patient really is important, and also where family viewpoints are valued and respected. And for the patient and the family members, there's always this sense that they're included, that nothing happens without their okay. And I really truly believe that family members should be welcomed into the care setting. And then, it's very important that we have better transparency. And I think there are trends in each of these areas that are very positive, and yet we do have a ways to go. So step one is to think about bringing a family member with you whenever you can. And this may not always be possible, but bringing a family member really provides you with support that you need during the visit. It's a second set of ears and eyes, so it's harder to miss important information that the doctor may be providing. And also, the family member can really help you understand kind of the situation and relate to the process of receiving care in a way that may be different than what you can attain on your own. And then family members are really key to some health strategies, especially those things that you need to implement at home, including health behavior changes, what's often called lifestyle changes. And we can go back to talking about family members. I do want to acknowledge that, not everyone is in a position to be able to do this. But I really encourage, either a friend or a family member to try to accompany you on your health visits. And I can say, personally, I found this to be a very useful strategy in my own healthcare. So second is a little bit of a twist and not something that you might necessarily bring to mind when you think about how to make your care better, but it's really to understand what a doctor needs to complete her work or his work thoroughly and efficiently. I think one place to start is to think about knowing and learning some basic medical terms. And, for instance, knowing a little bit about anatomy can go a long way. And the goal here isn't to converse with the doctor in medical terms, but it's really to more fully understand what's being said to you. And in some sense, is also a recognition that many physicians do talk in jargon. And in many cases, some of the information they're trying to provide, genuinely trying to provide to patients, goes over the head of patients. So knowing a little bit can actually go a long way in terms of just being able to pick up on what doctors are saying. So for instance, if you have a lung condition it may be helpful to note that the lung is composed of these tiny air sacs that each connect with each other to form these air tubes that eventually come together in this big thing called our windpipe, which is right below the surface here on our necks. If you have a heart condition, for instance, it may be good to know that the heart has 4 chambers. Pardon me for a moment. And this isn't saying that you should, become a medical student. This is really saying just take some time to know some of the basic terminology. And I'm going to run through this list very quickly, but this is just something I found online, which basically said, what are the 50 most important terms that patients should learn? And these are things like the difference between a benign and a malignant tumor, what's a biopsy, what's a polyp, what does in remission really mean? Because it doesn't necessarily mean that a condition is cured. It simply means that the disease is not getting worse. And many of these terms are thrown around in medical settings without really understanding whether patients understand them or not. And so I think to take the time to think about some of this terminology may be very helpful. And again, I don't want to give the impression that this should be necessary. I think if we had a better healthcare system and we had better alignment, more patient-centered healthcare system, some of this would be unnecessary. But I think given the current system, it probably is necessary to learn more about your condition and more about some of this terminology, because terminology is one of the big barriers to communication between patients and physicians. And while I say this about what patients should learn, I'm not at all leaving out the idea that clinicians should understand and learn how to better communicate what they have to say to be more effective at that. I'm just going on with this list, it includes these things like body mass index, hypotension and hypertension, both low and high blood pressure, an anti-inflammatory medication, sutures, a lesion, something that's non-invasive, which means that it doesn't require entering the body, and outpatient versus inpatient, acute, things like angina, gastroesophageal reflux disease, or GERD, which is essentially a long name for heartburn, cellulitis as a kind of inflammation or infection just below the skin, edema being swelling, and an embolism being a blood clot that moves through the body. So this is just a very short list. Many of these terms people are not really familiar with, and yet doctors use these terms all the time. I also think it is really important to have a list of your medications that you bring with you. This is a really good check on a whole process of trying to make sure that the doctor knows the medications and is ready to make comments on those medications. Unfortunately, part of our electronic health medical systems or health records don't always keep accurate information on medications. And I can say that from observing it with my own care. In terms of medications, I think it's also important to be honest with the clinician about whether you've missed doses. And this is something that is incredibly common. And yet there's a certain way in which both doctors and patients sort of look the other way and deny that this is part of the reality. But this is really important, particularly if the doctor's thinking about treating a condition more intensively or aggressively. It's important that they know how often you've been missing the doses of the current medications. I also encourage people to really learn the purpose of each drug that you've been told to take. And this is really important in terms of just having more fluency in terms of your healthcare. Be sure to list any over-the-counter medications, things like aspirin, or also any dietary supplements or herbal preparations that you're taking. Now, the thing is, doctors recognize the use of these alternative approaches is really common. Unfortunately, they often don't ask. And so for you to tell the doctor this important information is really critical to avoiding things like interactions between drugs and supplements or herbal preparations. I also think it's really important to keep a written list of the observations that you make at home. Some of the more important things are like recording your blood pressure. And here's a little example of recording blood pressure. I noticed that my formatting kind of got out of whack here, but I think you get the idea of recording your blood pressure and when you took it, and having this list available when you come in. And the same applies to things like blood glucose or blood sugar that's measured at home. If for some conditions, weight is an important factor to keep track of, or symptoms, whether you're having headaches, how often and what sets them off, or like GI upset, where, it's important for the doctor to know how frequently and what might be causing a particular problem. Pardon me. I also want to, kind of get across this idea that for many common conditions, there's a set of questions that the doctor has been really carefully trained to ask you. And sometimes if you know this list of questions, it really becomes much more simple to anticipate the questions and provide answers to these questions. Now, I'm not going to ask you to study all different conditions, but let's just take the example of pain. So the doctor is going to ask you these questions. And in some ways, it really helps to think about these questions ahead of time so that you aren't kind of fumbling for an answer or not understanding what the doctor's trying to get at. So for instance, exactly where is the pain? And I often ask people, use your index finger, point to exactly where the pain is worst for you. How severe the pain is. What does it prevent you from doing? And here's a tough one, how would you describe the quality of the pain? And these things may not necessarily occur to you, but we often think about pain being described as sharp or burning or throbbing or squeezing, pressure-like or stabbing. Just thinking about how to describe your symptoms is sometimes very helpful during your visit. The doctor will also ask things like, how long has the pain been there and has it changed over time? And as I suggest here, if it's a chronic problem, sometimes it really helps to write down when you have the problem and what leads to it. And then these other questions are things like, have you had any similar types of pain in the past, and does it move anywhere? Does it radiate to other parts of your body? Are there other symptoms that occur with it? And, what makes the pain worse or better? So again, this is a really complicated set of questions, but if you think about it, these kind of make sense when it comes to describing and thinking about pain and trying to figure out why a person's having pain. And, there are many other examples we could go through, but for instance, for an infection, some of the typical questions are, how high has your fever gotten? And of course, it really helps to have that thermometer at home that you can use if you're feeling at all feverish. Use it and write down the temperatures and the time. And other questions are things like, are you having a cough? Or are you having any belly issues? So again, each kind of general area has these questions. And sometimes it's really helpful to think about how you would answer these ahead of time. The next thing is really to be ready to ask questions. And this is kind of tough because in some ways, visits are so rushed and you have so little time that it's not always clear that the doctor wants you to ask questions. But a good doctor is always trained to make sure that they ask the patient if there are any further questions. And I want you to take this seriously because doctors genuinely do want to know if there's something they haven't covered that's really important to you, or if there's a detail in what you've been discussing that's been left out. Maybe it was something you didn't think about until, another 10 minutes later in the conversation. When the doctor asks if you have any further questions, that's the time to bring up this sort of information, and also a good time to ask for explanations in detail about what's going on. And, one of the things you can do is ask the doctor what you can yourself do to make the issue better. And as I said, it's also a really good time to just ask those questions you didn't bring up earlier. And sometimes these are sensitive topics. They may have to do with sexual health or violence in the home, things that are a little hard to talk about. But in some ways, this question is a really good way to bring up those questions if you haven't been able to earlier in the visit. And also want to make this idea that get across this idea that many patients, many people find that seeing a drawing or an illustration leads to a much better understanding. And I am always willing to take my pen and draw out pictures to kind of illustrate some of the ideas I've been talking about with patients, particularly if they involve some of these issues having to do with the anatomy of the body. And I think it's always a good idea. It may not always seem easy, but to really ask questions about treatment. And for any treatment that a doctor's suggesting, they have the knowledge and the ability to describe both its benefits and its potential downsides. And, we may assume that the doctor has considered all these things and chosen a therapy where the doctor feels that the benefits outweigh the downsides. But sometimes it's really helpful for you to hear the logic that a clinician uses to make those sort of decisions. And it also helps you understand much more the rationale for why you're being asked to do something. And I will admit, there are many times that doctors prescribe a drug or ask a patient to do something, get a diagnostic test that they know that the patient doesn't really understand. And, some of that is really unfortunate, but I think you can intervene to make sure that that doesn't happen to you, that you really understand not only a recommendation, but, whether there are any alternatives. And also sometimes it just helps to ask, what if I did nothing about this problem? What would be the consequences of that? And that often is a really good way of getting doctors to sort of say, well, you don't want to do that because of A, B, and C. And it's also another part of getting the most out of this discussion with the doctor is just to ask what you could expect to happen in the future. And, doctors really focus on trying to be correct and trying to provide accurate, reliable information. And sometimes they're really reluctant to kind of share information about future prognosis, in part because it is uncertain, and in part because, doctors don't want to take this small chance of being wrong. And so I think it's always good to sort of say, well, I know that you can't predict things exactly, but what should I expect to happen with, let's say, my diabetes over the next 5 years? Or what should I expect to happen with my low bone mineral density if it continues? And these often is a way of also kind of figuring out what you can do to keep a condition from getting worse. And part of this is also being empowered to ask doctors about prevention. And the fact is that our current healthcare system doesn't really emphasize prevention nearly as much as it should. But to get really good advice, it's important to say, what are the things I could be doing to modify my lifestyle to keep myself healthy? And one thing that's particularly helpful is you may know that there are lots of things that you could change. So in some sense, you already know what you might need to do or what the recommendations are. But a different way of asking that is to say, well, what one thing should I prioritize to change? What would be the thing that would change my outlook in terms of future health the most? And then fourthly, just want to get across the idea that patients can play a much bigger role in their own healthcare. And I've certainly kind of lived this mantra. Of course, it's easier to do that as a physician in my discussions with other physicians. But nonetheless, I see many opportunities within the patients I see for them to play a bigger role in keeping themselves healthy. Now, part of this is that prevention idea that I just mentioned. But, I think that there are lots of things that patients can do in addition to whatever treatment a doctor is offering. So if your doctor asks you to undergo a certain medication or to take a medication, it's often the case that there are some self-management strategies that can help these drug treatments become more effective. So for instance, one example was with heartburn. Quite often symptoms of heartburn are treated by giving a drug that lowers the acid in the stomach. And lowering the acid helps protect the esophagus, the food pipe, from getting irritated and inflamed. But at the same time, there's very good evidence that some things that can be changed in terms of diet and health behaviors can really help supplement drugs, or sometimes even take the place of drugs in treating heartburn. Things like reducing coffee or avoiding acidic foods, eating fewer fatty foods, which tend to make food stay in the stomach for longer. And also, important to have dinner well before you're going to bed. And these are very valuable strategies, but sometimes doctors don't take the time to fully explain them because in some ways, let's face it, it's easier to just write that prescription for a medication that is, in this case, quite effective. But the medication can be made even more effective by taking on some of these other strategies. And this is really the case for quite a range of other conditions. And certainly is true for many of the risk factors that can lead to heart disease and cancer. And these are things like getting more physical activity, improving your diet, trying to manage your weight as best you can, certainly not letting weight get anywhere above where it is right now if you have too much weight. But many other strategies can be really important in terms of both prevention and treatment. And the other thing is a really good step in terms of becoming more involved is really just to keep track and to write down some of the things that are going on with you. And particularly if it's a condition like high blood pressure or diabetes, we're actually making these measurements at home that actually could be very valuable in that they give the doctor a look at how you're doing long term, rather than something that happens just on one single visit. So I really encourage you to kind of become better at tracking what's going on with your conditions and also writing those down. So I want to get into a couple of ideas that are a little more controversial. And, one of the things that sometimes makes my life complicated is dealing with requests by patients for tests that I think they don't necessarily need. So I just want to make a couple of points here that sometimes more testing isn't necessarily a good idea. And it may be very easy to feel like more information is just better. There's more to act on. But the problem is that tests aren't necessarily always reliable. And for instance, there's a problem of false positive tests. This is where a particular diagnostic test, whether it's, an X-ray, an MRI, or a blood test, shows that there's a problem. And that false positive test needs to be followed up. There needs to be other testing done to confirm that the problem is really there. But after a while of anxious waiting in these other tests, in some cases, a positive test result can actually indicate that there was nothing there, that the suspicion was misplaced. And yet at the same time, you've worried about this issue and you've gotten more tests. And on kind of the flip side of this is this idea that sometimes testing can be falsely reassuring. This is a false negative. That is, a test looks negative, but it isn't necessarily true. And of course, this is the problem of indicating that there's no problem when in fact there is one. And again, this has to do with the fact that any diagnostic test is not 100% certain. If we get a positive test result, it often indicates that something is truly wrong, but sometimes it is a false positive. And often a negative test is reassuring, but we can't always be sure. And there always is that small possibility that a false test is a false negative. So in general, my advice is don't ask for tests that the doctor says are not helpful. Doesn't mean that you can't ask what are the different upsides and downsides of getting a particular test. But in some ways, it doesn't make sense to try to get information in this way when it may not actually help the diagnostic process. And one of the important lessons in this whole topic is that people at relatively low risk, people who are younger or generally healthy, they're the ones who are more likely to have these false positive or false negative tests. So I just want to, kind of throw this out there as something that I think it's important to understand how clinicians think about this test this test process, because they may not always fully articulate, what their logic is. And then I also want to make this point that, a prescription is not always the best option. And again, this is about knowing what's on the clinician's mind and asking them for information. There are a lot of conditions like viral respiratory infections, including, mild COVID, where really the best treatment is supportive care. That is, giving things that help the patient feel more comfortable, may relieve a fever, may keep the patient from getting dehydrated, may overcome the fatigue that comes with some infections. And in this case, actually antibiotics can do more harm than good because these antibiotics don't treat viral infections. They are really aimed at bacterial infections. And when used for a viral infection, they create this problem of drug-resistant bacteria. And it's really important to understand that any drug, whether it's an antibiotic or another drug, has benefits and it has downsides. And part of the planning of care is really to have the doctor and you decide whether the benefits of a drug are outweighed or not outweighed by potential problems. And this has, been a wake-up call around opioid pain relievers. The idea that doctors may have, and patients may have vastly understated some of the downsides, and the benefits may not be as great as we once thought. So it's important to kind of ask this question, what are the benefits? What are the downsides of this medication? And, in general, from the viewpoint of a physician who really does try to listen to patients, it's also about not asking for drugs that the doctor may already have decided are not going to have a net benefit. That is, they fail to have an overall benefit after accounting for those downsides. And this doesn't mean that you should just silently accept what the doctor's saying, but certainly ask questions that clarify what the clinical logic is. And also really important to remember that mental health issues are just as important as physical issues. And, although we might think about psychiatrists as being the true experts, which they are, all primary care physicians are trained to deal with mental health issues, particularly those issues that, may not be severe or may not yet been treated. So it's important to bring up these issues with your primary care doctor and certainly recognize that, these are things that they should be caring about and are certainly capable of treating. And, I want to just emphasize this point that, mental health issues are just as important as physical issues. And yet, I know that patients are reluctant to bring up these topics. Things like depression, isolation, or anxiety. These are really important issues because there are effective treatments, either talk therapy and or drugs. And in many other cases, some of these issues interfere with other treatments. And I would also say this is true for things like spousal abuse, sexual violence, marital and family stress, alcohol and substance use, as well as sexual health. So while these are sensitive topics, these are topics that doctors are trained to listen to and to take care of. And, we may not necessarily always immediately feel that degree of trust with doctors, but it's important to recognize that all of these things are within the territory that doctors are trained in. And, also ask the doctor for additional resources. Some of these can be in the form of, let's say, a handout that the doctor provides. And, these days, most doctors' visits come with this thing called an after visit summary, which essentially is a printout that the doctor helps construct, which gives you information about what the recommendations were. And doctors are quite able to just essentially add a handout to that after visit summary if you ask for more information. I would also say that there are some good websites online that can provide some very reliable information. And, while there are others, the ones I really like the best are the ones the federal government has really invested a lot of effort in making sure are accurate and also using language that most people can understand. And this goes for both the NIH or National Institutes of Health, as well as the Centers for Disease Control and Prevention, or CDC. I consider these to be, really important sources of information for patients. And in fact, there are Spanish versions of both the NIH and the CDC websites. So I just wanted to, emphasize this idea of asking for any notes on critical information. This may seem difficult for the physician to do, but in this era of electronic health records, this idea of documenting things for you and writing notes about what was communicated is much more common and actually quite easy for physicians to do. So, when you have questions, when you feel like you haven't really gotten the full story, ask the doctor to put a note in the after visit summary that tells you what you're supposed to do. And then also discuss what the best time is for a return visit. Many doctors, myself included, have a kind of tendency to think about some patients needing to return in 3 months, other patients in 6 months. These are very much ballpark estimates. And if a patient indicates that they would like to be seen more rapidly, a sooner visit, I'm completely amenable to that. But if the patient doesn't ask, sometimes it's one of these things where I don't think too carefully about when the return visit, because the front desk is going to expect that 3 months in the future visit. And sometimes that isn't frequent enough. So I've gone through the information that I wanted to present, and I know that we already have some questions lined up, but I wanted to just go ahead and start out with a couple of the questions that came in on the submissions. And I would encourage all of you now to add questions to the Q&A. You all have the ability to do that. And I may not necessarily get to all of the questions, but I'm going to go ahead and kind of moderate the questions, starting with some ones that came in on the submitted questions. So pardon me for a moment while I rinse my throat. So, one question that came in was how to pick a good physician. And I first of all want to emphasize this idea that I think primary care is very important. And I say that not only as a primary care physician, but I say it as a patient who over time has seen lots of specialists, but really always valued having a primary care physician. The primary care physician in some ways is the person who knows you as a whole person. That may be more difficult for a specialist, particularly because specialists are people like cardiologists who focus on the heart, or nephrologists who focus on the kidney, or ophthalmologists who focus on the eyes. The primary care physician is one way of bridging these multiple specialists that you may see together, and also in some situations, serving as an advocate for you as a person. It may be more difficult to do that directly with specialist physicians, and having the help of a primary care physician is important. So I wanted to make that point clear. In terms of finding a good physician, this has become more difficult because at least in the Bay Area, many physicians have closed practices, meaning that they are caring for the patients they already have, but are not taking any new patients. This creates an issue where it's not always feasible to choose your primary care physician. But I think that there are some strategies that you can use. One is to really ask around, and don't be shy about asking if your friends or family members have found what they consider to be a good clinician. I think it's also important to recognize that you may choose somebody and you always have the chance to choose somebody else. So having a first visit with a doctor is really a good way of finding out what their style is, what sort of rapport you have with them, and whether you just get a sense that they're somebody who you're going to trust with your healthcare. If you don't like a person, I fully recommend getting a new primary care physician. And, that's usually much easier than you might think it would be. Sometimes it does require giving a call to your insurance company, health insurance company, and sometimes it does require the old physician to transmit information to the new physician. But again, in this era of electronic health records, that's becoming easier and easier. So I think my main advice here is kind of see for yourself after you've maybe whittled down a list based on recommendations. The other thing is, and some of my colleagues aren't going to be liking me saying this, but even clinicians who are closed often will take a few new patients, and it's worth asking the staff at the doctor's office if that's possible, particularly if there are very few physicians available with open schedules. So I'm going to shift a little bit to look over some of the questions. It looks like I have some great comments here. One is that not only to keep a list of your medications, but also a list of any allergies. And this is really important because particularly for things like antibiotics, quite often our first choice of an antibiotic turns out to be something a patient may be allergic to. And it's really important that the patient be able to transmit that information. Now, quite often, there is a list of allergies in the health record, in the electronic health record. But just as I said with medications, it's not always the case that those allergies are up to date or fully correct. So having a list of your allergies, any medications you have allergies to, is an important part that goes right along with having a list of medications. So one question that came up from several submitted questions, as well as in the Q&A, was a question about what do you do when the doctor seems to be dismissing your concerns, where they don't seem to be taking seriously the issue that you have, maybe thinking that it's just telling you it's nothing, even though you're concerned about it. What do you do in that situation? Well, I don't think that there's any specific one thing to do, but I think some of the strategies that I've talked about before are really important in terms of making sure you invest ahead of time to write down your concerns. And if it's something that you feel like has been dismissed in the past, then to write some follow-up questions that actually, require the physician to provide their clinical logic about why you shouldn't be worried about it. So, you could say something like, I hear that you want to reassure me about my back pain and the fact that it doesn't represent something more serious going on in my body, but I am concerned about it. And, I'm concerned that, maybe it's indicating that I have cancer, or maybe it's indicating that I have bone problems. Being very explicit about what you're worried about can sometimes be helpful in terms of just making sure the doctor knows where you're coming from, and to have invested time in thinking about perhaps researching a little bit about your problem can be very helpful. And again, the idea here isn't to substitute your knowledge for the clinicians. It's not to necessarily challenge the physician that they're missing something, but really being able to converse with the doctor in a way that is satisfying. So, I also want to say that I wish this was not as big a concern as it is. I think that there are many clinicians who don't fully appreciate the sort of needs of patients. And one example of this is that, for most clinicians, it's really important to figure out what the diagnosis is. And a diagnosis often leads to a recommendation of a particular treatment. For clinicians, that's what the visit is all about in some sense. But from the patient's point of view, it's not so much about finding the right diagnosis. It's how do I deal with certain symptoms or signs of disease that are going on for me? And how can I be reassured that the treatment is actually going to be helpful? Or can I understand how a treatment is going to be helpful? So I think that all of these issues come together in such a way that I wish it weren't necessary for patients to take this initiative, but sometimes it is. And I think that even the best physician is often rushed and has much less time than they would really like to see patients. And, I think that it's important to sort of recognize on some level that, physicians are part of a system that they need to work in, but don't necessarily always, feel comfortable working the way that the system asks them to. I have another question here about, issues of continuity, where you may lose a physician because of retirement or because they move to a different system or move to a different state. And it can be a real problem if you have long-term chronic problems bouncing between clinicians. And, there's not necessarily a good solution. I think this is one of the problems of the system we have. But I do want to say that to the extent you can track some of these things yourself, make sure that you know what your medication list is and your allergies, and keep track of things, in a notebook at home. These could be a real tool in making sure that there's continuity in your care, even if you're seeing a different physician. And, quite often, clinicians rely on the electronic health record to make sure that there is information in there. So if another clinician needs to treat you, they can read up on you and really know what's going on. So one of the strategies that I want to recommend is actually looking through your doctor's notes to make sure that it's complete and accurate. And also, this is a way of you getting some insights into what the logic is that the clinician may be using when they recommend something. This is now essentially required that clinicians share their notes with patients. This is relatively new over the last decade, but you should know that you are able to read your electronic health record notes that the doctor has put together. And this can be a way of learning more about what's going on with your condition, and also a way of kind of figuring out what new knowledge you need to attain to be able to have better conversations. At first, some of these notes are going to seem full of jargon. And you can always ask the clinician at the next visit, what did you mean when you said this? But it's also a way for you to identify, for instance, vocabulary that you don't know and look it up. I want to just acknowledge one of the comments here that, most of the suggestions don't apply to some cultures. And I think that this is changing to some degree, but it's very true in my own observation that many Latinx patients, particularly women, and also Middle Eastern patients from, Iraq, Syria, other places in the Middle East, tend to be much more comfortable with a paternalistic type of healthcare. That is, in some ways, they're not so willing to ask questions or to question the doctor, but really want the doctor to tell them what to do. And, in some sense, that kind of cultural difference needs to be respected. And certainly there are ways in which my own presentation to patients and how I talk to patients changes based on their cultural background. Now, I will say that, I think things need to change. And in fact, this pattern is not so evident if you, for me, in my own observation, is not so evident for patients who are, in their 40s or younger, but it certainly is true of an older population. And I just want to get across this idea that, I think there's a need for respect in those sort of situations and not necessarily expecting that everyone is going to be their own advocate. And then I just want to kind of touch on a couple of things. There will be a recording of this session if you missed the first part of it. And here's another kind of really good tip, which is there are various community programs that are really oriented towards giving people more information and helping them do better at various, prevention or treatment ideas. So diabetes is so common that it really needs to be something that is treated or dealt with by more than doctors. And there are a number of community resources out there to help people manage their diabetes better or to be involved in trying to prevent diabetes, particularly if they have prediabetes or what's often called metabolic syndrome. So I think that these kind of programs in a way are a supplement to what you might get within the doctor's office, and very often have as one of their goals teaching you more about the condition that you have. And I see a couple other recommendations here. One is keeping a daily health journal. I think that if you have a number of chronic conditions which are changing, which aren't always the same, then recording on a daily basis can be very valuable. Just one example of this is that for people who have migraine headaches, sometimes it's very difficult to identify what are the things that cause these headaches. We know that, some things like stress or certain foods or certain situations often lead to migraine headaches. But unless you record that information, sometimes it's very difficult to discern what's really going on by just, retroactively kind of trying to remember what's happened over the last month. However, if you write things down and then take that written description to the doctor, sometimes that's very, very helpful in terms of trying to figure out why a certain condition is occurring when it does. So I want to just finish there. I know that I have not answered all of the questions that have come in. I certainly want to, just say thank you for being part of this talk. This is a really different talk for me, and I can see by some of the comments that these sort of thoughts are appreciated, and I do appreciate all your attention, and again, apologize for the fact that I haven't necessarily been able to answer all of the questions that were submitted either ahead of time or during this hour that we've had together.